Namaste, good morning, and welcome to TimesHealth Plus. I am Dr. Sneha Rathi. I am a musculoskeletal physiotherapist and a certified yoga teacher from the Yoga Institute, Santa Cruz, Mumbai. I combine the techniques of physiotherapy and yoga and give the best results to my patients through them. Today, we are going to talk about one of the very sorted after topics, which we have covered before also. But now onwards, this is going to be like a series of sessions. So, from today onwards, I'm going to start a series of sessions on this topic. And it is nothing but the something related to understanding your lower back. Okay, so it's a very common condition. The prevalence of low back issues is a lot these days, especially because we have been sitting for a long time or even standing for a long time without exercising much. So, in this series of sessions, we are going to understand how we can refine our movements to make it more lower back friendly. Okay, so for that, you will have to have the understanding of why low back pain occurs, what are the different causes of low back pain. If you understand that, then I think you will be able to deal with it much better. So I'm trying to give you some information that is going to actually help you in building that lower back endurance, strength and mobility, which is going to actually help you to manage your lower back well and to stay away from lower back conditions or pain. If I ask you to name some common low back conditions, or you must have heard about a lot of conditions, something that we call as lumbar spondylosis, there is something called as spondylolisthesis, lumbar spondylolisthesis. There could be something that is called as the PIVD or the slip disc, commonly known as the slip disc. Okay, there is lumbar radiculopathy, where there is pain that is radiating into the leg. First, it starts with the low back pain and then it radiates to the leg. There are different sprains and strains related to low back. So, for a simple example, I can tell you that maybe you were, bending down to pick up something and suddenly you got a catch in the back. This kind of stuff can happen. Or if you lifted something and there was a sudden pulling sensation in the back, very common in people who go to the gym. I've heard that sometimes they are doing some lifts and suddenly they got a catch in the back. Okay, so sprains and strains are very common, especially if you are not working your muscles very well on a daily basis. If you are only targeting some specific muscles and leaving the other muscles, like that, it can definitely lead to sprains and strains. Okay, so this, and then there are infections, some severe conditions like infections and tumors, which definitely needs medical intervention. You cannot do something on your own to deal with them. Okay, so these such things are there. And then of course there is emotional stress, which can also lead to low back pain. Okay, so there are so many things related to low back pain. All right, so certain conditions are exclusively for the medical intervention, but certain things that all these whatever I have mentioned, it's more related to the structural change that happens in the spine. Okay, so if you are diagnosed with lumbar spondylosis, they see some structural changes on your x-ray or MRI and then come to the diagnosis or even your clinical examination. Okay, that will tell us that you are having lumbar spondylosis. But what goes on before this happens? So let's understand what actually happens before you end up having lumbar spondylosis. Okay, so we have a theory that is called as the kinesiopathological model. Okay, so what happens is we develop certain movement patterns and we keep moving in the same way. If we are not training our muscles, if we are not training our movements well, we will keep moving in the same way, we will keep creating pressure on the joints in the same way, and eventually if the movements are not very right, it is going to actually create some degenerative changes in our joint. Okay, so first is your movement habit or your movement pattern, the way you bend forward, the way you walk, the way you sit and stand. Everything involves a lot of movement, and it involves a lot of movement and movement coordination at the different joints. So it's very, very important that you train it on a regular basis, and which is why we say that you need to practice yoga on a regular basis. Okay, so our movement patterns first is the most important thing. What movement pattern you are following will decide what joint is getting stressed or strained, and then that can eventually lead to some pathology. Okay, so if you are thinking that you move anyway and it would be fine, if you are exercising anyway and it would be fine, it's not the case. We need to know how to move in the right way. All right, so that's very, very important. So this is the kinesiopathologic model, but it could also be vice versa, that because of pain you started moving differently. Okay, so sometimes what happens when we have severe pain, we tend to have a different kind of movement to avoid that pain. Okay, and that movement actually sometimes can continue even after the pain has subsided. So if you have had a low back pain episode, you started moving a little differently to avoid that pain, but that pain has subsided, even then you are continuing to sustain the same type of movement after that. That can lead to even worsening of things. Okay, it can lead to imbalance in the posture, it can lead to imbalance in the way your muscles are working. That can change the stress and strain on the joint and eventually lead to further pathology. And that's why it's very, very important to train the gyan bhav of your body. Okay, to understand that you have to train your body on a regular basis with the right kind of movements, to assess your body on a regular basis as to which muscle is a little weak, where I need to train it better, which movement is giving me more trouble. Okay, which where I need to actually fix certain things. Okay, if you follow this process well in advance, you would not be in a situation to get such low back pains or issues like this. Okay, so this is very, very important. Of course, there are different risk factors that are involved. For example, age. Okay, there are certain hormonal issues or medical issues that can lead to low back pain very easily. I'm not talking about those aspects, but I'm talking about just the movement aspect of it. Okay, so that you can train it well, that is going to help you a lot in avoiding these conditions. Plus, of course, the lifestyle is very, very important. So being a physiotherapist, I have seen many cases, okay, wherein we see after a lot of alteration in the movement, the patient is coming, and it takes us a good amount of time to fix that movement pattern back to normalcy. Okay, so it is this is a very slow and gradual process which you may not even realize. I will give you a very simple example. When we try to bend our hip and knee straight up like this, okay, sometimes we because of certain even weight issues, we might have a tendency to do this, okay, just to adjust the movement. Okay, and we continue to do this can create, if we continue the same type of movement, it is definitely going to create a muscle imbalance at the hip level, at the lower back level, and that can eventually lead to pain, which is why fixing these movement patterns on a regular basis becomes very, very important. So I'm going to take you through the different asanas, and as always, I will tell you the small pointers that you need to remember when you are working on your lumbar spine or your lower back. Okay, so you can focus on these pointers and try to work through it, make your asana better and better on a daily basis. Try to achieve the right kind of muscle recruitment and get the correct results. Of course, if you have been suffering from a condition already, it is definitely recommended to get assessed by a medical practitioner and get the right kind of treatment. Okay, along with that, if the medical practitioner recommends, you can definitely follow the yoga asanas that he has told you, he or she has said that it is safe for you to practice. Okay, so that's how you can slowly and steadily work on your lower back. All right, with this, let's go ahead with the asanas. Today we are going to see more of lying down asanas. Okay, because I want to show you how you can begin with the asanas when you have a low back pain or you have a weaker lower back. Okay, so we are going to start with certain beginner asanas and then go on to a little more advanced asanas, or some asanas are going to be a little more advanced. So you can try and attempt them as per your capability and convenience. All right, it is not recommended to do the asanas on a bed, but if you have a flat surface which is a little rigid like the floor, you can lay the yoga mat on top of it and try to practice it. That's going to be more effective. Okay, so instead of using the bed, if you cannot lie down on the ground. All right, so let's start first with the conditioning practice. We are going to keep our legs together, join our hands in front of the chest, and we are going to do Sthit Prarthanasana, which is the conditioning practice. Okay, so keep your legs together, hands joined in front of your chest. Look at one point in front of you. We are starting with the conditioning, and slowly you can close your eyes. If you are uncomfortable closing your eyes and losing balance, you can keep your eyes open, or you can even increase the distance between your feet. Bring all your attention towards your body and your breath. We are doing our duty towards our body. So, this is the Dharma Bhav. Observe your posture, observe your breath. Now, slowly, when you're ready, you can relax and release your hands and open your eyes. You can take a little bit of distance between your feet. And now we will start with the warm up first. So, we are going to take our neck up and down 7 times. 1, 2, 3, 4, 5, 6, 7. Now slowly turn your neck to either sides. 1, 2, keep breathing normal. 3, 4, 5, 6, 7. Now drop your ear to the shoulder. 1, 2, 3, 4, 5, 6, 7. Now slowly keep your hands on your shoulders and turn your elbows around. Try to make big circles. 2, 3, 4, 5, 6, 7. And the other way around. 1, 2, 3, 4, 5, 6, 7. So this was about shoulder. Now let's rotate our wrist. So 1, 2, 3, 4, 5, 6, 7. And the other way around. 1, 2, 3, 4, 5, 6, 7. Okay, now we are going to twist our body. So you can keep one hand on the opposite shoulder, one hand behind, and just twist and come back. Change the hand position, twist and come back. Again, 2, 3, 4, 5, 6, and 7. Now we're going to raise our hip up one by one. Okay, so lift up 1, 2, 3, 4, 5, 6, 7. Okay, I'm going very controlled manner. It's not a very if you are taking your leg up, I'm not just leaving it down like that with a thumb. Okay, it's a very controlled movement that I am doing. It's very important to have that control in each and every movement that you are doing. Okay, so you have to make sure that it's a very conscious effort. Now rotate your ankle, 2, 3, 4, 5, 6, 7. Okay, now the other ankle, 1, 2, 3, 4, 5, 6, 7. So most of the times I have seen a lot of people that they do the ankle rotation. When they are doing the ankle rotation, it's the entire hip that is rotating. If that is happening, slowly and steadily try to take support of the wall and then try to do observe, look at your foot, and then try to slowly learn the movement. Keep your hip and leg steady and try to slowly just focus on your ankle movement. Okay, try to get it more and more isolated at the ankle. Okay, because you are training your muscles of the ankle to work in an exclusive manner without usage of the entire hip. Whatever you train here on the yoga mat is going to translate into your functional activities, your daily activities. So whatever training you're doing here is going to be taken forward through the day. So it's very important that you're doing a very conscious practice when you are on the mat. All right, so this was our warm up. Now let's start with a few asanas. I'm going to start with the lying down poses. I'm doing that because I'm considering that if someone's lower back is weak, they need to first start with the lying down poses. That is going to be a little easier for them. So I'm just going to sit down. Okay, whenever you have any kind of lower back issues, you should always, and anyway, even if you don't have, you should always turn on your side and then lie down. So you can lie down like that. The first posture that we are going to do is a lying down cat and cow pose. Okay, so in this position we are going to do the pelvic tilts. So what you can do is you can keep your hand under your lower back area. All right, now slowly what we are going to do, with the knees bent and shoulder width apart, we are going to slowly arch the lower back as much as possible so that the pressure on your hand that you have kept below your back is reduced. Stay there for 6 counts. 1, 2, 3, 4, 5, 6. Now slowly go for a posterior pelvic tilt and try to flatten your back as much as possible. You will feel more pressure on the hand that you have placed below the back. 1, 2, 3, 4, 5, 6. Now again, arch your back, less pressure on your hand. 1, 2, 3, 4, 5, 6. Flatten your back, more pressure on your hand. 1, 2, 3, 4, 5, 6. Okay, we have kept the hand so that you get a feedback of if you are doing it right or no. Okay, again, arch your back, stay there. 1, 2, 3, 4, 5, 6. Flatten your back. 1, 2, 3, 4, 5, 6. Okay, now if you see, if it is visible to you, you can try to look at the back position. Okay, when I'm arching the back, this hollow is created below the back. Okay, and you have to look at that. 1, 2, 3, 4, 5, 6. When I'm flattening the back, it is absolutely gone over here. There is no hollow under my lower back. 1, 2, 3, 4, 5, 6. Once again, arch. 1, 2, 3, 4, 5, 6. Flatten. 1, 2, 3, 4, 5, 6. Okay, so this is how you can start with the cat and cow. It's an absolutely supported position, so it will not create any low back pain. Okay, it's a very safe position to practice the cat and cow exercise or asana. Now next one is we are going to do Supta Bhadrasana. So what we are going to do is we are going to join our feet together, and slowly we are going to allow our knees to drop down. Okay, now when you do this, drop down as much as possible. It's a very common thing to see that your lower back is arching up. Okay, in that case, you first try to flatten your lower back as much as possible, and then slowly try to push your knees down towards the ground without arching your back, and stay there. 1, 2, 3, 4, 5, 6, and back. Because if you keep practicing this posture with an arched back, it can actually create the opposite effect. It can create more lower back pain than usual. So you need to have a very neutral back, and then you need to slowly push your knees down. 1, 2, 3, 4, 5, 6, and slowly relax. You can stay there for a longer period of time also. 1, 2, 3, 4, 5, 6. For now, I'm restricting it to 6 counts so that we can see more and more asanas for the lower back. Let's do it one more time. Now this time, I'm going to slowly lift my legs up and hold it with both the hands. Try to push the knees down and stay there. 1, 2, 3, 4, 5, 6, and slowly relax. So if in case this is becoming a little stressful for the lower back, this is going to ease the pressure from the lower back a little bit, and you can stay in that posture. 1, 2, 3, 4, 5, 6, and slowly relax and release the posture. So this was the Supta Bhadrasana. Next, we are going to go for Setu Bandhasana. Okay, so here what we do is keep our hands by the side, keep our feet about shoulder width apart, slowly push on your feet and rise up as much as you can. If you feel that your back is a little weak, you can slowly bend your elbows and try to support your back upwards and stay there. 1, 2, 3, 4, 5, 6, and slowly take it down. Okay, it's very important to return back to the neutral position in a very slow manner. I have seen many a times people do this properly, but they tend to release the back like this. That's not a very good idea to do. It's very important that you have a slow, controlled return back to normal. Let's do it once again. You can support your back with your hands and slowly, slowly remove the support of your hands gradually. Okay, so let's start once again. Inhaling. Support your hands on your back. Stay there. 2, 2, 3, 4, 5, 6, Exhale. 1, 2, 3. We will do it once again. Inhale. 1, 2, 3. Stay there with normal breathing. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. So this is supported bridge. If you are able to, do the bridge without support, you can just slowly lift your hip up and stay there. 1, 2, 3, 4, 5, 6, and slowly back. Okay, so this is what you can do. If this is also easy, you can offload one leg, keep it on the top of the other, and slowly do a single leg bridge. 1, 2, 3, 4, 5, 6. Down. Do it on the other side. 1, 2, 3, 4, 5, 6. Down. Okay, so if you are able to do normal bridge, you can do a single leg bridge. That's also going to strengthen your hip muscles a lot and the back muscles a lot more. Okay, because this is like an asymmetry. It's going to activate your core. Okay, and also you will have a comparison of what is the strength of your two legs. So if one leg is weaker than the other, you can definitely work on that leg. Okay, so this was about Setu Bandhasan. Next, we are going to go for Pavan Muktasan and some variations of it. Okay, so let's do it slowly. You're going to raise your leg up and take it towards your abdomen. Point your feet down. Keep the other leg straight down and stay there. 1, 2, 3, 4, 5, 6. Slowly relax. The breathing over here is inhale and exhaling. Bring your knee towards your chest. Press it on your abdominal wall and stay there with normal breathing. 1, 2, 3, 4, 5, 6. Inhaling. Straighten your leg and exhale. All right, now we are going to add some variations to this. Okay, so we are going to first take our knee straight towards the same side abdomen. 1, 2, 3, 4, 5, 6. Now we are slowly going to turn our knee towards the opposite side abdomen and chest. 1, 2, 3, 4, 5, 6. Now we're going to slowly release the knee to 90 degrees and drop it on the opposite side as much as we can go. Keep the hand away from your body. 1, 2, 3, 4, 5, 6. Now just release this posture. Bend your other knee and slowly bring it towards the abdomen to stretch the hip. 1, 2, 3, 4, 5, 6. Relax and release. All right, so we did about four variations of it. Let's do it on the other side. The same thing. Exhale. Breathe normal. 1, 2, 3, 4, 5, 6. Now knee pointing the opposite side. 1, 2, 3, 4, 5, 6. Now get it to 90 degree. Drop it towards the opposite side. 1, 2, 3, 4, 5, 6. Slowly bend the knee. Keep your leg on the opposite thigh and pull it towards you. 1, 2, 3, 4, 5, 6. And slowly relax and release. This will instantly clear any tension which is accumulated in the hip area and is affecting the back. Okay, because the hip and back is very closely related. It's very important to release any tension in the hip area that has been accumulated, which can indirectly affect the back. So let's do this Once again, this flow, entire flow, okay? So we are going to keep our legs straight. Slowly inhale and exhaling. 1, 2, 3, 4, 5, 6. Opposite side. 1, 2, 3, 4, 5, 6. Lower down and drop. 1, 2, 3, 4, 5, 6. Bend the opposite knee and slowly pull it towards you. 1, 2, 3, 4, 5, 6. And slowly relax and release. So we do it once again on the left side. Inhale and exhale. Breathe normal. 1, 2, 3, 4, 5, 6. Opposite. 1, 2, 3, 4, 5, 6. Drop. 1, 2, 3, 4, 5, 6. Place it on the opposite thigh and pull it towards you. 1, 2, 3, 4, 5, 6. Slowly relax and release. When you do this, you will instantly feel the release of back or hip tension that has been accumulated. Alright, so this was about the Pavan Muktasan variations. Now let's do the next asana, which is going to be like where many people do attempt this on a regular basis. It's like rotating the leg around, making circles of the leg as much as they can. Okay, now I'm just going to clear certain things about this. So what happens is when you try to do this exercise on a regular basis, I have seen many a times the back is very unstable and you are rotating the hip with the back moving all around. Okay, so this is what happens. Okay, can you see my back is not stable and it is also turning around with the hip. Okay, so what I recommend you to do is first is try to make smaller circles and keep your hands on your pelvic area. Okay, you can hold your pelvis over here with both the hands. Try to keep it as stable as possible. Now try to incorporate your hip movement. Make smaller circles first. Okay, try to keep your back stable with smaller circles. 3, 4, 5. Once you are confident that you are able to keep your back stable and it's not turning with the hip movement like this, okay, then you can probably increase the range of your circle as much as you want. Okay, but you have to ensure that your back is relatively stable. Okay, we'll do it on the other side 5 times. 1, 2, 3, 4, 5. All right, so this was about the hip rotations or hip circles. Next, we are going to do Yashtikasana, a very important, a very simple asana, but a very effective one. We just keep our hands by the side, slowly inhaling, raise both the hands up, stretch up, point our toes down, and stay there. 1, 2, 3, 4, 5, 6. Exhaling down. Once again, inhale. Stretch your upper body up and lower body down, but make sure you're not arching your back too much. Okay, stay there. 2, 2, 3, 4, 5, 6, and down. Once again, inhaling. 3, 2, 3, 4, 5, 6. Exhale. One last time. Inhale. Stretch. 1, 2, 3, 4, 5, 6. Exhale. Alright, so this was about Yashtik Asana. So these are some of the postures which you can do lying down straight on your back. Okay, next we are going to turn on our side and we are going to see what side movements you can do. Okay, so the same rotations, hip rotations that you did on your back, you can do it on the side as well. You take your leg forward, lift it up, take it back and bring it back. Okay, again forward, up, back, down. Okay, 3, 4, 5. All right, now again over here also, it's very important that your back doesn't sway along with your hips. So as you're taking your hip forward, your back is also moving. Okay, if you're taking it up, your back is also arching over here. It shouldn't happen. You have to try and keep your back as neutral as possible. Try to move your hip. That's how you are training your hip muscles to work with a stable back. This is going to avoid a lot of back pain. All right, so this is how you can do it. Let's do it on the other side, the same thing. So I'm just going to turn around. Keep one hand on your waist so that you know if your back is stable, and slowly bring your leg front, up, back, down. Again, 2, 3, 4, and 5. All right, so this was about the side rotations. Now you can go for a side plank just to activate your side back muscles. Usually we focus a lot on the front muscles and the back muscles, and we forget to work on the side muscles. Okay, so it's a good idea to do a plank to activate them. To make it easy, you can bend your knees, or you can keep your lower knee bent and upper knee straight. You can keep one hand on the ground and slowly just push up and stay there. 1, 2, 3, 4, 5, 6. Down. Okay, if you feel that you are confident enough, you can offload your hand. 2, 2, 3, 4, 5, 6. If you are doing it right, you will feel a lot of activation of muscles on the side. Okay, let's do it one more time. 3, 2, 3, 4, 5. Down. Okay, so this way we are actually activating all the muscles around the lower back. Let's do it one last time. Inhale, breathe normal. 4, 2, 3, 4, 5, 6, and down. Okay, we do the same thing on the other side. So you can bend the lower leg, keep the upper leg straight. Slowly push and stay. 1, 2, 3, 4, 5, 6. Down. Okay, if confident, offload your hand, push up, take it beside your waist. 2, 2, 3, 4, 5, 6. Down. Okay, once again, inhale. 3, 2, 3, 4, 5, 6. Down. As much as you can raise, it's fine. Even if it is little less, it's fine. But just try to do a very clean movement when you're doing it. Once again, 4, 2, 3, 4, 5, 6, and down. All right, so this was the activation of the side muscles. Now we are going to go on our back. Okay, and we're going to just lie down like this. So it's a very good idea to at times stay up on your back like this. Okay, this is a good position to, because we have been bending forward all the time throughout the day. It's a very good way to do an opposite movement and stay there for some time. It's going to actually activate the smaller muscles in the back area. You can, if you want to increase the activation of muscles, you can slowly add a neck extension to this. Stretch up a little and down, just the neck part. Okay, even if you stretch your neck up, you will feel that your lower back muscles are activating. Okay, so let's do it once again. Inhale and exhale. Once again, inhale and exhale. 3. You can stay up for 6 counts. Inhale. 1, 2, 3, 4, 5, 6. Exhale. One more time. Inhale. 1, 2, 3, 4, 5, 6. Exhale. So if you are unable to do a Bhujangasana very effectively, you can just practice this for the initial phase. It's going to activate your muscles. Then you can go for Bhujangasana. We are going to rest for a few seconds in Makarasana and then go for another muscle activation. We go back to the same position once again. Okay, so my fists are together. Now slowly I just want to activate my side muscles, the muscles on the side of my waist. Okay, so what I'm going to do is I'm just going to turn my head to this side as if I'm trying to look down and come back, and to the other side. 1, 2, 3, 4, 5, 6, and back. If you feel, if you're doing it right, you will feel a little bit of sensation of muscle contraction on this side. Okay, let's do it once again. 2, 2, 3, 4, 5, 6. Back. On the other side. 2, 2, 3, 4, 5, 6. Back. One more time. 3, 2, 3, 4, 5, 6. Back. On the other side. 3, 2, 3, 4, 5, 6. Back. And slowly relax in Makarasana. Next, we are going to go for Bhujangasana. And as I talk to you about the emotional aspects of lower back pain, okay, so it's a very important thing to make sure that you address those aspects as well, okay. And a very important, aspect of it is incorporating bhavas in your practice. This has been formulated at the Yoga Institute, the different bhavas that are necessary, the positive emotions that are necessary when you are practicing. And asana is a very good way to incorporate those bhavas in your body. You would not even realize when those emotional aspects are addressed when you are doing the asana with those bhavas. So now we are going to incorporate the Aishwarya bhav, or the bhava of self-esteem, self-confidence when we do Bhujang Asana. So let's see. When we are doing Bhujang Asana, we are going to do it very confidently. Okay, so keep your forehead on the ground, hands beside your chest. Slowly, with a rising self-esteem, slowly inhale and rise up as much as you can and stay there. 1, 2, 3, 4, 5, 6. Exhaling down. We will do it once again. Legs together, heels together, feet on the ground. Try to hold them close to the ground throughout the practice. Now, slowly inhale with confidence. Rise up. 2, 2, 3, 4, 5, 6. Exhale. Once again, inhale. 3, 2, 3, 4, 5, 6. Exhale. So it's okay if you are able to rise only this much. It's fine. As you keep practicing, you will be able to rise up more and more. All right. So it all depends on the practice that you are doing. You can do a bhujangasana with the full extension. Okay, so a full bhujangasana, you can do it with your hands by the side, and slowly you can just push using your hands up slowly. Okay, over here, what happens many a times I have seen, because of tightness in the hip area and the lower abdominal area, people tend to rise up on their hips like this. Okay, so what happens is your knees are down and your hip is rising up like this. In this case, you slowly and steadily try to get your hip down towards the mat. You can practice this movement gradually just to open your lower back and hip area, and slowly go back down. All right, just repeating the same movement, like without any if you have been doing this like this all the time, it's not going to be of much use. Okay, in fact, it can create some stress on different areas, maybe on the knee or something. So it's very important that you modify the posture. Try to keep your pelvis as close to the ground as possible, and then try to rise up from the back. Look straight and stay. 1, 2, 3, 4, 5, 6. And slowly down. You can relax in Makarasana once again. Next, we are going to do Shalabhasana. So we keep our chin on the ground, keep the hands by the side, and slowly raise one leg at a time straight up from the knee. Point your toes down. 1, 2, 3, 4, 5, 6. Down once again on the other side. 1, 2, 3, 4, 5, 6. Down. 2, 2, 3, 4, 5, 6. Down. 2, 2, 3, 4, 5, 6. Down. So over here, it's very important that when you are raising your leg up, you're not straining your back excessively to just raise the leg up. Try to use the muscles of your leg and your lower back in a very sequential manner, so that the entire leg and lower back is stressed equally and there is no excessive stress on one particular area of the body. Okay, so you can try to make it more and more refined by focusing on where exactly you are feeling the stress. If it's more on the back, ease your back a little bit. Try to recruit more muscles of the leg. This is how you can modify the Shalabhasana. Let's do it once again. 1, 2, 3, 4, 5, 6. Other side. 1, 2, 3, 4, 5, 6. Down. Alright, so this is how you can do Shalabhasan. It's important to keep your chin on the ground. Okay, many a times I have seen when people do Shalabhasan, they tend to, as soon as they lift the leg, their neck also goes like that. Okay, if this is happening, then you need to make sure that you have fixed your chin on the ground and raise the leg a little less. Don't allow your neck to flex when you are raising the leg. Okay, so that's about Shalabhasana. Now let's see one with the knee bent. Okay, so I'm going to bend the knee and then raise it up. So again, keeping my chin on the ground, I'm going to bend the knee to 90 degrees. Now slowly activate the muscles and stay there. 1, 2, 3, 4, 5, 6, and down. On the other side, 1, 2, 3, 4, 5, 6, down. Once again, 2, 2, 3, 4, 5, 6. 2, 2, 3, 4, 5, 6. Now, when you are doing this, it's very important to understand the direction your hip is raising. Sometimes I have seen that people tend to raise it across. It automatically happens because certain muscles are weak. In that case, you just need to make sure that you're giving the right direction to the hip. So try to keep the chin on the ground, bend your knee, and if you are not able to raise it this much, it's fine. You can just initiate the movement and hold. 1, 2, 3, 4, 5, 6. Down. 1, 2, 3, 4, 5, 6. Down. Okay, even this much movement is fine. It's not about moving more, it's about moving the right way with the right muscle activation. Let's do it one more time. Breathe normal. 1, 2, 3, 4, 5, 6. On the other side, 1, 2, 3, 4, 5, 6. Down. All right, so this was about practicing with the knee bend. Now let's go on all fours and we will do one last asana, which is the Bittilasana and Marjorie asana. The same cat and cow pose in the all four position. We're going to just arch our back as much as we can and flatten it. Or move it the opposite direction. This is going to create a good amount of mobility at the spine. Now we add, as we are dropping our back down, we add a neck extension movement to it. And we do the opposite. Flex our neck along with this. So inhale, 1, 2, 3, 4, 5, 6. Exhale. 1, 2, 3, 4, 5, 6. Inhale, 1, 2, 3, 4, 5, 6. Exhale. 1, 2, 3, 4, 5, 6. Inhale. 1, 2, 3, 4, 5, 6. Exhale. 1, 2, 3, 4, 5, 6. And relax. Okay, so this is how you can practice cat and cow position on the all fours. Okay, now let's just relax for a bit. We are going to do equal breathing because breathing is equally important to keep your back healthy. So we are going to keep our hands on the thighs, sit in Sukhasana, keep our back erect as much as possible. Without excessive pressure on any area of the body, we are just going to focus on our breathing, so you can close your eyes. Now we are going to do 3 counts inhale and 3 counts exhale. Try to do the equal breathing. Inhale. 1, 2, 3. Exhale. 1, 2, 3. 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 Relax and breathe normal. Observe your breath. Slowly, you can rub your palms. Keep it on your eyes. Feel the warmth in your hands, on your eyes, and slowly open your eyes. All right, so this was the different asanas which you can do in the lying down position. Okay, so today I have demonstrated the different asanas which we are supposed to do in the lying down position, and one asana which I have demonstrated on the all fours. So that's the task of the week. You need to practice the cat and cow pose for about 10 reps on a daily basis. Okay, and feel what exactly is happening in the spine. You can click a picture of this. You can share a video of this on Instagram and tag TimesHealth Plus. You can also express how you are feeling in the lower back when you are doing all of these asanas consciously. All right, you can also follow TimesHealth Plus on the Instagram and YouTube channels for more tips and recommendations related to yoga. All right, so this was it for today. We discussed the different aspects of movement. Okay, we discussed the different ways how we can refine our postures. This is going to help you activate the right muscles, target the joints properly. If you train your movement with more and more gyan bhav, more and more consciousness, it's going to be very effective. We will discuss more in the upcoming sessions. Okay, some more asanas which you can do in the sitting position, in the standing position, and also how you can incorporate these bhavas on a regular basis. It is going to actually help build good emotional state in your lower back as well. It's so effective. All right, so with this we are going to cover in the upcoming sessions, so make sure you do join the next sessions every Sunday. All right, so that was it for today. I'll see you next time. Till then, stay present, move gently, and make sure you take care of yourself. Thank you and namaste.